While research has proven that meth labs pose an immediate threat, there are no studies on the effects of long-term exposure. But narcotics officers in Utah believe they've found out about meth's long-term hazards the hard way.
Debbie Dujanovic continues an Eyewitness News investigation.
Tonight, the number is growing. We've now confirmed 40 of 58 Utah officers who investigated meth labs are sick, have cancer, or have died.
In March 2005, Debbie Dujanovic of NBC's Salt Lake City affiliate learned that several former narcotics officers in Utah were suffering from unexplained illnesses.
We just cold called several of them and said, "How's your health?" And funny you should ask. Let me tell you, I've got esophageal problems. I've had an autoimmune disease. I have asthma. I can't breathe. Heart attacks, strokes. Cancers at the age of 30. It was just overwhelming.
In the last 5 years, I've made 11 trips to the hospital, 3 heart attacks, 4 angioplasties, procedures involving kidneys, pancreas.
First of all, it was, my gallbladder, and they took it out and said, there was something strange with that. And then I started having what they thought were kidney stones and chronic coughs. And eventually it evolved into, kidney cancer, and they removed one of my kidneys.
My health has really declined. I think I'm older than I should be. My body's older than it should be.
Kelly Call is living with a precancerous condition in his throat. While there are currently no studies attributing chronic disease to long-term, officers believe that years of working in these toxic conditions have caused serious health problems.
It leaves me with a feeling of anger, frustration. Had I known that my exposure to methamphetamine and the labs would have caused these problems, not only would I have not gone into them, none of the people I worked with would have gone into them.
There's always you always wonder if it could be something else, and it could be, but I would put my money on the exposure, and I'm 90% sure that that's what it was.
And officers also suspect some cases of exposure have been even more serious. Russo also worked narcotics with Gary Sterner and his wife Kelly Nye Sterner during the 90s. Kelly logged many hours in the evidence room sorting caustic meth ingredients. Her husband says she often coughed and choked on the fumes. Kelly was diagnosed in late 1999 with mastocytosis, a rare cell disease.
Her liver grew to 3.5 times its normal size. Her spleen grew to 3 or 4 times its normal size. They had to remove her gallbladder. They had to remove her spleen because it was too large. And then she finally had kidney failure.
She died in January of 2005. She was 49.
I would have liked to spend a lot more time with her. It was too short. We were only married 2 years. We were together for about 5. We were married for 2, but it seemed like it was still the honeymoon stage. Still very much in love.